this Monday. Dr. Kristen Simpson with Simpson Dental Associates is here with us this morning, looking all rested and relaxed. You have a Merry Christmas?
I sure did, yes. How about you?
Well, good. I sure did. If you got a question for the doctor, you can call the number right there on your screen. But while we wait for some calls, let's talk just a little bit about you. Where you've had a root canal on your tooth, could that cause cancer later on?
Okay. Well, there have been some recent studies that have been released that have shown that about 90% of terminal cancer patients have had root canal treatment. So this has made people scared that these root canals are leading to cancer. Well, the reason why this study has happened is because the bacteria that causes the abscess in the tooth has been the same type of bacteria that's linked to cancer. You know, we often talk about how the bacteria that's in your mouth relates to your overall health. We actually have a bacterial test here that we might be able to show you that shows the bacteria that is linked to several different conditions relating to your overall health. So it can relate to heart disease, stroke, diabetes, Alzheimer's, arthritis. So, I mean, that's why it's important to make sure you're taking good care of your oral health so that you're keeping this bacteria down so that it's not being related to your overall health. So, for example, in this picture, the red is the bacteria that relates to heart disease and stroke. So, as you can see, it's over that red line, which is the threshold for that bacteria. So that means that that person has too much of that bacteria in their mouth. And several of those other ones are over the threshold too. So this is one of the results of a bacterial test that we have done on a current patient to show that this bacteria does relate to overall health conditions.
Let's go to the phones. We have a call from Arlen. Arlen, good morning. What's your question for the doctor?
I have a cyst that's coming on my gum, and this makes the second one in the past 2 years, and it's within an inch of each other.
Okay. Well, if you have a cyst in the gum, there can be a couple reasons why this is happening. It either means that the tooth is abscessed and it's trying to find a place for that abscess to drain. When this drains, it causes some inflammation in the gum tissues. It could be that, it could be abscess from decay in the tooth, or it could be abscess from gum disease in the tooth. If it's gum disease, you might start to notice the tooth being mobile because it might have some bone loss around the tooth. So these are two things that could be causing it. You need to go to the dentist to have an x-ray taken of the area, and they can do some probing around the tooth to be able to verify what's going on in that area.
All right, Arlen, thank you for your question. And one thing that I think you probably get a lot of people talking about as they're coming into the office, do you really need an electronic toothbrush to get the job done?
Yes, people do ask us that.
Oh, yes, you do? Or?
Well, if you don't think you're doing an effective job with manual toothbrushing, an electric toothbrush can be a great aid to use. I use just a manual toothbrush, but if you're not using the right angles or don't know the right amount of time, this is all built into an electronic toothbrush. So it really can be something that can help you to get to those areas all the way in the back and to help time things for you, and they can shut off if you push too hard. So those can be all good things for an electric toothbrush.
We have a call from Audrey. Audrey, good morning. What's your question for the doctor?
I have blisters, or it's like blood clots behind my tonsils. And I was wondering if you could tell me what that could be.
Well, this might be an issue that you need to see an ear, nose, and throat doctor about. Things that are in your tonsil area might be something that you would need like a test, like a biopsy or something for, to be able to tell for sure what's going on in those areas. So if it's something that's persistent, definitely make sure you're
going to get that checked out. That's not really your area of expertise.
That's right, yes.
Okay. All right, Dr. Kristen Simpson, than40 for coming in today.
Okay,
we had some good questions.
Yes, we did.
There is more news still ahead right here on Fox 11 Eyewitness News this morning. The time is 7:40.